When it comes to competition training, everyone is trying to find an edge on the competition or a more efficient method to improve their health. However, it is important to understand why an edge may exist. In many cases, this edge exists for the benefits and health of the user. This is true when considering ergogenic aids. For this reason, it is important for a subject or practitioner to do their due diligence before recommending an ergogenic substance. This is why I am investigating the world's most consumed drug, caffeine. Ergogenic aids are substances or phenomena that are work producing and are believed to increase performance. However, there are many concerns that arise when designing a research study for ergogenic aids. This is due to the effects of multiple variables. A study by Pickering and Gergic in 2019 found that the effects of caffeine's ergogenic properties can vary among subjects based on these factors, including the amount taken. Caffeine has consistently been shown to improve performance when consumed in moderate doses, approximately 3 to 6 milligrams per kilogram of body mass. Outside this range, caffeine has a minimal effect. If you go above this range, it can actually have negative side effects. It includes subjects where there is genetic properties that impact the effects of caffeine. Subjects who carry a gene to produce more of the enzyme that metabolizes caffeine will show a more rapid effect due to the stimulant. Subject experience also impacts the effect of caffeine. Trained individuals might experience greater performance improvements than untrained subjects following caffeine ingestion. Even the gender of the subject had an impact on its effect. There were significant differences in caffeine concentrations post-exercise, with females having a greater amount. This suggests that females don't metabolize caffeine as rapidly as males, hinting that females might benefit from a longer time between caffeine ingestion and exercise trials. The task being performed by the subject also showed variation. Aerobic endurance appears to be the form of exercise with the most consistent moderate to large benefits from caffeine use. And how it is used also has an impact. Habitual regular users of caffeine have also shown a blunting of its acute ergogenic effects. So caffeine is a stimulant that is rapidly absorbed into the bloodstream. Blood levels begin to rise 15 minutes after the consumption and peak 30 minutes to 2 hours later. These levels remain high for 3 to 4 hours. Studies correlate its use to increased exercise performance in endurance activities, as well as its possible ergogenic effects for both intermittent and strength activities. Caffeine's ergogenic properties include enhanced cognitive function, including attention and vigilance, a short-term substitute for the benefits of sleep in sleep-deprived subjects, a decrease in fatigue, even in high heat or low oxygen consumption environments, an increase in muscle contractibility, and an increase in catecholamines levels and breakdown of triglycerides. Caffeine can affect multiple types of cells, including muscle, liver, and fat cells. Caffeine has long been recognized as a stimulator of the central nervous system due to users' increased alertness and decreased drowsiness. Evidence of enhanced function of skeletal muscles shows caffeine use can directly increase muscle force, work, and power. And the ergogenic effects of caffeine are indicated by an elevation in blood glucose and fatty acid utilization. Caffeine is classified as a central nervous system stimulant. The best evidence of this is the decreased perception of fatigue in prolonged exercise. This observation has been linked to caffeine's ability to block adenosine receptors. When adenosine binds to receptors in the brain, it induces fatigue. The chemical structure of caffeine is similar to adenosine, allowing caffeine to block adenosine receptors. So caffeine's ability to block these receptors reduces the sensation of both tiredness and fatigue. Skeletal muscles directly provide the movement ability necessary for physical activity. So caffeine's impact on muscle contraction directly affects an athlete's performance. Caffeine influences muscle contraction by stimulating the release of calcium. Caffeine promotes the movement of calcium through the sarcoplasmic reticulum and sarcoplasmic membrane. Calcium diffusing into the cytoplasm between myosin and actin filaments of the muscle fibrils causes the filament to slide into each other, triggering the contraction of the entire muscle fiber. Therefore, increased release of calcium ions by a neuromuscular stimulus enhances contraction power in muscle fibers. Caffeine's thermogenic properties are related to its mobilization of glucose and fat. This has the effect of preserving muscle glycogen from a greater distribution of fatty acids in the bloodstream and energy use under some conditions. Caffeine stimulates the process of lipolysis, hormone production, and reduces the muscle dependency on glycogen. Caffeine causes these effects by increasing the body temperature, causing an increased rate of metabolism. The mobilization of fat induced by caffeine breaks down free fatty acids as an energy source, saving muscle glycogen. Caffeine also increases the production of hormones such as dopamine, epinephrine, and norepinephrine. An influx in these neurotransmitters alters mood, memory, alertness, and cognitive function of athletes, which can lead to an improvement in their performance. Caffeine has consistently been shown to improve endurance by 2 to 4% across many studies, using doses of 3 to 6 milligrams per kilogram of body mass. In an evaluation of 2,686 urine samples of elite athletes, 73.8% of the samples contained caffeine in concentrations higher than 0.1 micrograms per milliliter, indicating that 3 out of 4 athletes had consumed caffeine before or during sports competition. These results were collected from athletes of different modalities, including endurance athletes such as marathoners, game athletes such as football players, and strength athletes such as powerlifters. In anaerobic training, evidence supports caffeine as an effective ergogenic aid for enhancing velocity and power in resistance exercises. Generally, the primary sports-related goal of strength and power-oriented resistance training programs is the ability of the athlete to lift greater loads at higher velocities, which caffeine has a positive benefit. In aerobic training, a study showed that acute caffeine supplementation improved the time to exhaustion during supramaximal effort. The majority of adult studies report that caffeine increases aerobic performance. Many studies conducted among athletes competing in team and individual sports report that caffeine may enhance performance in a variety of sports tasks as well. Caffeine's effects can be quite varied, many related to the mechanisms of action described previously. Its effects range from the nervous system, where caffeine activates areas of your brain and nervous system to improve focus and energy while reducing tiredness. Hormones, where caffeine increases circulating epinephrine, the hormone responsible for fight or flight response, which can increase performance. And body temperature, where caffeine has been shown to increase thermogenesis or heat production, which raises your body temperature and may help you burn more calories. Caffeine is a safe supplement at the recommended doses. It may cause minor side effects in some people and should be used with caution in individuals with heart disease, high blood pressure, GERD, and several other conditions. Many of the side effects only impact certain populations or occur when the dosage is too high. These side effects include increased heart rate, anxiety, dizziness, insomnia or sleep deprivation, irritability, tremors, and sometimes stomach discomfort. So caffeine does have some downsides. It's been associated with an increased risk of sudden cardiac death because it can cause an erratic heartbeat. It is also diuretic, meaning it causes you to urinate more frequently. This can lead to dehydration, especially if you're not drinking enough water or if you're exercising vigorously. Over time, caffeine causes your body to lose calcium, which can lead to loss of bone density and osteoporosis. It increases anxiety, nervousness, and insomnia in some users. For these reasons, the following groups of people should avoid caffeine or talk to a medical professional before use: pregnant women or women who are breastfeeding, children, people on certain medications, people who have certain conditions such as heart disease, liver disease, and diabetes, and people with some mental disorders such as generalized anxiety disorder or panic disorder. As I have stated, caffeine is one of the most common ergogenic aids taken. This is because it is one of the most effective exercise supplements available. It is more accessible, affordable, and relatively safe to use than many other supplements. Studies have shown that caffeine can benefit endurance performance, high-intensity exercise, and power sports. For these reasons, I believe that caffeine is a relatively safe ergogenic aid, and I recommend its use for athletes and non-athletes alike. Due to its accessibility and safety, I do not recommend any restrictions on its use for the general public or for athletic performances. I do use caffeine both for training purposes and in my non-training everyday purposes. Thank you for listening and have a great day.